Hello, we are live. Welcome. I'm going to give it a minute. Okay, hey guys, welcome. All right, so I'm so excited. This is the first time we're doing this set of series. Today we are going to be interviewing Dr. Dan with Peak Vitality. I'm actually going to bring him on. Guys, thanks for tuning in. Hi, welcome.
I'm great. How
Hi,
are
Dan.
you?
How are you? I'm doing good. I'm so excited to talk with you guys today. We're with you today and everybody else here. Welcome, guys. Thanks for tuning in. This is Dr. Dan. If you have not heard me talk about him before, he specializes in integrative medicine, and he has been a huge blessing to our family. My husband. There's a bit of an echo. Let's see. Yeah, I think if you turn the volume down a little bit. Yep,
All right.
that's good. Awesome. Awesome. Well, thank you for tuning in, guys. We're going to dive right in. Today's topic is women's health and specifically fertility. Dr. Dan specializes in that. He's an expert on the topic. He has helped tons of women. I don't want to steal his thunder. He'll talk about it a little bit more, but he has helped so many women, you know, if they were struggling to get pregnant. He has a lot of experience in this. Dan, how about you tell them just a little bit about your background, how you got into integrative medicine, and just like what your
Absolutely.
passion is behind there.
I started this way back when I was doing my undergrad back in Indiana, and I was really considering a path into physical therapy. And my mom, she happened to get really sick and really struggled. She had some thyroid issues, a lot of health issues. And, it kind of became a commitment at that point to her health and to her recovery to start to understand this process. Started with her thyroid. And because of the thyroid and the autoimmune connection that she had there, it really took me on a different path. So first I started looking at, what natural therapies would actually be able to help, and got really involved in Chinese medicine. And I moved to Houston and went to the American College of Acupuncture and Oriental Medicine down in Houston. And it's a really awesome school because they were integrated with the hospital system there. So I got to be involved in the hospital in Houston, at Methodist Hospital in the medical center. And I got to participate in some research, and that really seemed to set a spark in me. And I really started looking at the connections between the Eastern approach, some of the herbs and the lifestyle and dietary approaches. And then I was also looking at, on the Western side, like, how do we marry those two, and what did the research say? And what was interesting is I have these really difficult cases, and that's all I took on early in my career, was difficult cases. And so, it gave me an opportunity to say, okay, well, from a Chinese medicine or like an Oriental medicine perspective, how do we approach that? Because that's a very successful modality by itself when it comes to fertility and hormones and chronic illness. But then when you can extrapolate the data on the research from that, and correlate that with other data from the Western side, it amplifies the response that you get from people, because you have two different ways to narrow down. It's almost like creating a laser focus with natural therapy. So that's what we started doing. And so I was treating a lot of autoimmune and hormones, and the natural cross section with those were fertility. And I started getting, I had some of these women I was treating for different hormone issues and autoimmune, and fertility was never my goal. I'll tell you straight off from the beginning, it wasn't my ultimate goal. But we were having a lot of success by just getting their bodies balanced, getting where it's working the way it's supposed to. And so I started getting a lot of referrals on that aspect. And so it just kind of blossomed from there. And I went back to school and got my doctorate in Chinese medicine, and it was a specialty degree in integrative medicine. And now here in Denver, we've created an entire integrative office. We have our our medical director, Dr. Minton, he's an OBGYN, and we have nurse practitioners and nutritionists and other acupuncturists and other nurses. We have such a great integrative team. And now we take a very unique approach. So when someone comes in, it's just like the process that we went through with you is, we sit down and then we go through a really detailed exam and consultation because we want to make sure we're not missing anything. And then our whole team, when we get those lab results back and we get all these findings from our exam, we sit down and our whole team dives into what was found, and we start to identify the major things that have to be addressed first, these priorities we call them. So we identify these priorities, and then we build up a plan, a unique plan that fits that individual. And it's been an amazing approach, been an amazing ride, and we've been fortunate because we get to touch a lot of lives this way.
Yeah, I mean, you have touched our family in such a great way. I mean, with Nick's health, I'm excited for the journey that I'm embarking on with my health. And obviously you've helped a lot of our best friends as well, which has been a real big blessing. Basically he's like saved one of our best friends' lives. So no big deal. Pretty exciting stuff. So Dan and I thought it would be really special because a lot of you here I know are women. We were wanting to dive a little bit deeper into women's health and fertility today. And so, Dan was telling me that there's specific things for women at each stage. So we've got, the stage of life where you're trying to get pregnant, trying to conceive, if that's you. And then you've got obviously your 10 months, they say 9, it's 10 months of pregnancy. And then we've got the postpartum, which is a whole nother ball game. And so Dan, I love just some of the different things that you were telling me about each phase. Can you touch on just your perspective on women's health and like what we need to be doing different in each of those phases?
So I think, one of the biggest takeaways in the whole piece, whether you're trying to get pregnant, whether you're trying to maintain a healthy pregnancy, or you're post pregnant and you want to show up with this new child and be able to nurture them and have the energy to show up and be the mom, because that's the one thing, you say when you think about being a mom, you envision yourself showing up with energy and doing all the things you want to do. And the reality is that isn't the case for a lot of women. If they make it that far, if they're fortunate enough to have a child, a lot of them, they start having their first onset of some major health issues, or fatigue is just, this plaguing fatigue outside of the fact that your sleep's already going to be, pretty disrupted, right, from the new one in the family. But the first thing that I would say is, if you're having issues at any of these stages, whether it's trying to conceive, maintain a healthy pregnancy, or it's a postpartum situation, if there's a problem, it doesn't mean the body's not working. It means there's an underlying health issue. And that's a critical piece, because a lot of women come to me and they just say, I just can't get pregnant. And when they say that, the first thing that I jump into is something's going on with your health. That's a problem with your health, because fertility is a part of vitality. And if it's lacking, that means the vitality is lacking as well. So there's some underlying issue. Even if you don't feel like you have a health problem, something's going on, because that's a healthy function of a healthy body, right? Yeah. So that that's the first piece. I would say that's the first kind of across the board thing to understand.
And would you say there's a commonality between all these women who are coming to see you, and then you're realizing, that they've got some fertility issues? Is there like a common health thing between all of them that you would say?
I would definitely say that there are a lot of overlapping pieces that we see, like with infertility.
Okay.
And this is, and Daniel, I got to tell you, this is what's really surprising to me, is most of the women that are coming to us for fertility, they've already gone to specialists. They've gone to specialists. They've gone to their doctor, their OBGYN. They're maybe even consulted or tried IUI or IVF, and it failed. And there are some very specific things. The first one that we see in all categories is that there's some underlying low-level inflammation every time. And that's a problem because inflammation, we always say that it's stressful and it's corrosive to your body. It will damage anything that it touches. It triggers a lot of other health issues, but it's these low-level symptoms that a lot of women don't realize are symptoms of inflammation. So like, you know, headaches, even if they're not constant, like these reoccurring headaches, any type of body aches or pains, sometimes you get a little bit of postnasal drip, fatigue, brain fog, energy issues, and you know what's really interesting and surprisingly, and this is going to be a shock to a lot of people, if you have low libido or any issues with like lubrication, like natural lubrication, that's a hormone that's related to fertility. So it's important to know, like, you know, I have a lot of women and they say, well, I my libido's shot, and I'm like, well, that's a big part of this, right? It's like that's the hormone that drives the process. So inflammation is a big one. There's usually a disruption in their blood sugar, and it's usually light. It's usually hypoglycemic function, and that is that's an underlying cause that we see a lot with just basic fertility. And I'd say the third thing is I haven't seen a single woman come in that's struggling with infertility that didn't have some nutritional deficiencies that are needed in order to get pregnant and stay pregnant.
Wow. Interesting. And what would you say, what are the number one things that you recommend to people who come in and they've got some serious inflammation?
The first thing is, yeah,
Is it
I mean,
supplement?
there are some good supplements. Resveratrol is amazing for inflammation, and it also it helps with stabilizing the blood sugar. It is an amazing molecule and does some amazing things across the board. Resveratrol is a good one. And then, you know, an anti-inflammatory diet is a really good way to go. And because it gets difficult, and if you know, a lot of times I say you just implement those things. I've had women watch our webinars and they just do the small changes that we recommend, and like vitamin D, maybe some resveratrol, and an anti-inflammatory diet, and a lot of them are able to conceive, you know, just by making those small changes. Yeah.
Wow. That's amazing. And you were sharing with me a little bit about your success rate with helping women to conceive. I think Nick is getting home. Oh no, I think it's my father-in-law. Terrible timing. But so you were telling me a little bit about your success rate. Would you mind diving in with them, just like why you believe that you have such a great success rate when it comes to
so
helping
throughout
women
the
get
pandemic,
pregnant?
our success rate wavered between 65 and 68% of women that we worked with were able to conceive, and a lot of them were able to conceive within 3 months. Not everybody did. Some of them took a little bit longer, and I don't think it's because we have some miraculous approach. The thing is we don't go into it with a preconceived idea. You know, usually, I'm gonna keep talking. Usually, the thing is there's so many things that can contribute to the infertility. So our goal is to identify what's unique for that individual. So we don't have this cookie cutter approach, and it's all about identifying what is particular to that individual, and correcting that. So it's like we don't have just one option, you know, up our sleeve for each individual. We have multiple options, and the approach really needs to be based on what's unique about that individual. So it's because we have an individual approach that we have the success rate that we do, and I don't doubt that at all.
I think it's amazing. I think it's incredible for women to know that there's another option. I think a lot of women, and you know, I've experienced miscarriage, and you just kind of feel stuck. You feel like, is it something I've done? And which can be a very destructive thought. But if you just have, you know, are aware that there are other options,
Yeah.
helps bring you hope, and it's just a good thing. So, sorry about that. That was my sweet little great grandma.
I went with it.
Bad timing, but she's as cute as can be. And so let's talk a little bit about once women do get pregnant, what are some of your number one health tips for women who, you know, whether they struggle to conceive or they have an easy time conceiving, once they're pregnant, what is your number one or top three
You
tips
want to
for
make
women?
sure that you're on an excellent prenatal. And when I say excellent, it needs to be researched, right? Because your nutrient deficiencies during pregnancy are going to contribute massively to the health of that child. Now, whether you can maintain that pregnancy, like for instance, zinc, and a lot of people don't know this, every time that egg divides, you know, how many times does it divide during the development of your baby? Like billions of times, right? And every time it divides, it requires zinc. And so, how much zinc do we need, right? So, you want to make sure you have the right
Wow.
nutrients, and it's shocking because if you don't have the proper nutrient balance, for instance, iron, some women go into pregnancy with already suboptimal iron levels, and if the baby is going to get all of the iron that they're going to use for the first 8 months of their life in the last trimester from the mom and the consumption of the mom's diet or the mother's diet. So, and if you have vitamin D deficiency, there's just some crazy research on this that if a mother has low vitamin D during the second and third trimester, it affects their child for the first 21 years of their life. So the one thing you want to do is it's good to know, and this is one thing it's often better to test, to know your nutrient levels, your micronutrient levels, because those are essential and you're going to pass those on. So if there's something where you don't feel optimal, dig in a little bit because you're creating an optimal environment for that baby and you want to give them every chance to have wonderful health and make the most of their developmental stages. So one, make sure you're taking like an excellent prenatal, and in the prenatal, the big one is stay away from folic acid. You want folate. Folic, yeah, that.
Oh, can you dive a little bit deeper into that? Because um, interesting. Because
Yeah,
you always hear when you're pregnant, like make sure to have one
yeah,
with folic
folic,
acid,
yeah,
right?
folic acid is a
Okay.
synthetic, and it has no effect on human biochemistry. There's some really good research on that. It's not natural. It's
Wow.
missing what we actually need from the folate, which is what's called a methyl group. So you can either go with methylfolate or you can go with folinic acid. And some people have some mutations there, but there's when this is not properly supplemented, there's a lot of correlation with poor detoxification, which actually sets a child up a higher likelihood to be on the spectrum, right? So and then that's also what you find in kids that typically are on the spectrum. Their ability to properly utilize folate is disrupted, and a lot of times it starts in the womb. So you don't want to use folic acid. You want folate. I think that's a big one.
Okay. And
Yeah.
that's
So
FOLATE.
yeah, stay away from
Late.
that. You want to
Okay.
get some folic. You want it to actually be folate or methylfolate, and then so that creates something called functional folate deficiency, which we'll see a lot of times in reoccurring miscarriages. Also, you want to make sure you get plenty of choline. Choline is a massive. It's good, same pathway methyl donor, but it gives a lot of energy, and you need that. So really good nutrients, good folate, good choline. You want to make sure there's plenty of omega fatty acids, right? And the foods that we typically eat are super depleted. So, some of your top nutrients, and I'll just kind of give you a list. You want to make sure plenty of vitamin A, D, E, and K. Those are your fat soluble vitamins. Plenty of DHA, which is your fish oil, and that's going to help with the developmental stages of the baby's nervous system and the cardiovascular system. Biotin, the folate, choline, and glycine. I would say those are the top nutrients that we see major deficiencies in. So as far as nutrients, got to get those things in. We got to feed that baby. Okay.
Wow. Off the top of your head, do you have a brand
Yeah. You
recommendation
know
for
what?
the
I
women
love Life
watching here?
Extension. They have an excellent prenatal. It's very well researched. It's good quality, and I don't usually recommend any supplements unless I've seen that where somebody started taking it and we could actually measure the long-term outcomes of taking that, and that's an excellent prenatal. And I don't have any I don't get any, yeah, I don't have any
ties to them.
attachment or link to life extension. It's just I do have an attachment to seeing really healthy babies. So that's an excellent prenatal.
Yeah. Okay, wonderful. And so what is your number 2
for
tip
pregnant
for the
women,
pregnant women?
I'd say you definitely need to be careful of even increased inflammation during that phase. There's a lot of things that drive inflammation, and inflammation is going to disrupt the body. So and it's usually it's going to be like chemicals, household cleaners, your tap water. I'm really big on the tap water, so you can get on ewg.org and go to their tap water database, and you put in the zip code, and you can pull up and you can see everything that's in the tap water. And because it's going to be these chemicals that are going to disrupt or create some inflammatory process. So someone who already has had maybe some miscarriages, or had trouble getting pregnant, you really want to keep inflammation down, and minimizing chemical load is a great way to do that. So filtered water, but check out the EWG database. It's mind blowing, the stuff that you can find, that people are consuming, and that goes for autoimmune and other hormone issues as well, not just fertility.
Okay, so we have a question here. I'm gonna go ahead and pause.
Yeah.
I know you have a number 3 tip. So Kaya, love, are you seeing this? So she said folic acid, ? And then she said, I have 3 miscarriages. So I'm not sure if she hopped on after our conversation about the folic acid or maybe during. But do you have anything that I would recommend Kaya, I hope I'm saying that right, Kaya. I would recommend going in and seeing Dr. Dan. If you missed it before, Dan, you have a 65%
typically,
success rate, correct?
Yeah, we quickly identify issues, and if somebody has, one of the things that we'll do that helps maintain that rate, and we're not after that success rate, we're just after to help people, but if they have an issue that we don't think we can help, we'll refer them out. That's one of the reasons, because we've actually had a lot of women that have tried IVF and IUI and failed, and they have to go that way because maybe they don't properly ovulate on their own, or they have damage to their fallopian tubes. So even those women, when we get through our program, everything's working better. Their body's a better environment to be able to nurture and successfully maintain that pregnancy. So even with women, so part of that success rate is also women that we know going into it, they were going to have to do some type of assisted reproductive technology. Yeah.
That makes sense. Yeah, because sometimes, and I love your perspective on that. It's not an all or nothing. It's not like this way or no way. It's like this, if it's a fit, and if there's other things going on, you're open to, you're not anti any of these things, anti-IVF, but there's like a time and a place for each type of medicine. Is that what you would say your philosophy is?
I don't care if it's 10,000 years old or if it's 10 minutes, 10 minutes, old, as far as our knowledge when it comes to health. All of those things, all that data, all that understanding is super important, right? And so it has its place and its time.
Yeah.
And and everybody's different on who's going to need what type of intervention, right?
Yeah, that makes sense. And so, oh, Kaya, can you tell me something to get pregnant? Well, I would recommend just going in and seeing him, and because Instagram, there's lots of labs to be run, and he's got to see you in person. So did you say you had a third thing that you were jumping back over to our conversation? A number 3 thing that you would recommend for women once they have conceived?
So, and this kind of goes on both, but it's really important during pregnancy, is gut health. And the gut health is really critical. And this is gonna be a massive tip for any women who got pregnant and they're struggling to get back down to their weight. So when you're during pregnancy, the hormones that increase in your body to maintain that pregnancy, they alter your gut bacteria. And so your gut microbiome switches to a very identical gut microbiome of someone who has weight problems, because it's actually it helps you increase the fat content on your body, so you have energy during the pregnancy and postpartum. Like if you're breastfeeding, you need a lot more energy. So it actually, the hormones alter the composition of your gut bacteria. And if your gut health is not maintained, maybe some healthy probiotics or plenty of fiber, that gut bacteria doesn't alter the way it needs to, and it doesn't go back to the way it was supposed to. It becomes very pro-inflammatory. And that's super important, because when you give birth, the root of your child's immune system is going to be based on your current microbiome in your body, all this bacteria in your body. And because there's a huge correlation between the vaginal biome and the gut biome. So maintaining healthy gut is super important during pregnancy.
Oh my gosh, these are great tips. And it does seem to be, it's interesting that your top 3 tips really are ones that people can apply, even a man can apply. Gut health, you know, well, maybe not a prenatal, but probably good vitamins and stuff. And then your water, inflammation. Interesting. So just overall health things are really.
It's the same things. It's, you know, honestly, it's no, what we do is there's no secret sauce. It's all the things. I heard years ago a quote, I use it all the time in the office, and it said, "Does a wilted plant still need water, sunshine, and nutrients?" You know, because you do, and a lot of times if you have a plant that's sick, you give it those things, and it takes care of itself, right? You don't have to medicate it. You didn't have to cut anything out. The body a lot of times is the same way, but the weird thing is we don't apply that same wisdom to our own health. And at Peak, what we do is we really dig into those details, and we say, what is really the unique makeup about this person that is lacking or needs some TLC?
I think that's a great approach. So moving forward, now we're in the postpartum phase, which that is where I am at right now. So hearing you talk about the gut health was really interesting, especially because I do not take a probiotic, which is terrible.
Yeah.
So I'm going to need to implement that. I'll text you after this asking for recommendations. But what are the main things that you see women struggling with their health?
Well, typically postpartum, women will start getting symptoms that they've never experienced before. One, their body's more depleted than it's ever been. Like we said, the microbiome, their gut bacteria is massively altered. But this is when autoimmunity and hormone imbalance really starts to rear itself. Most women are going to develop their first autoimmune antibodies after their first child, and if they have a second, that's usually when it really kicks in full storm. But a lot of times it's going to happen with that first. So along with the fatigue, the stress that happened on the body, the strain on the immune system to make you heal from having the child, a lot of times that's where things get very, very disrupted. And this is the time, and it's dismissed a lot because they feel more, you know, like their schedule's fuller than it's ever been, and it is. But this is the time to focus on your health and your recovery, and that's what you have to think of postpartum as, is recovery. And so because you've lost blood, you've lost nutrients, your immune system's been altered, and the gut has been altered, a lot of things start to occur. So postpartum depression, usually massive connections to the gut, and then health issues and autoimmunity, which again have massive connections with the gut. So this is the time, if you're ever going to focus on your body, you really need to make time at that point, because you're setting yourself up for the whole entirety of the rest of your life on how you handle your health after you have a baby.
Interesting. And so, what are some signs that women need to look out for on the topic of an
Yeah,
autoimmune issue? Is that what you were saying? Um, you had mentioned
yeah,
like feeling low energy, which can be hard to distinguish between, is there something going on in my body, or did my baby just wake
yeah.
up 5 times last night? um, I feel like I'm kind of in that phase where I feel depleted and I feel even on a good night's sleep, I feel like I
Yeah,
rely on some things. And I think a lot of moms, it really is like the mommy
yeah,
culture is coffee, and like survival mode. And I think what you're saying is like there's a better way. There's something we need to be
yeah,
focusing on during
absolutely.
that
So
phase.
the things to watch out for. So there's kind of these big four symptoms that typically happen. One, you start getting sensitivities to things, whether it's foods or the environment. You just start noticing that you have multiple sensitivities, and sometimes you just can't pinpoint what that is, and it might change. Like one day you eat something and it causes a lot of indigestion or body aches and pains or swelling, and then a week later you have the same thing, no problem. That's actually a big clue. Okay, so multiple sensitivities that
Interesting.
sometimes are reactions that you just can't narrow down. The second thing is you try a bunch of things to help yourself get better and nothing works. That's the big clue number two. Um, Number three is even after you go to see a practitioner and you start a treatment plan, it doesn't give you long lasting relief. I mean, there's probably people that you know that have said, they started something, they felt good for a little while, and then they went back to right to where they were. Those are massively important symptoms. And then the fourth one goes around that is you get multiple diagnoses. People, one doctor diagnoses you with one thing, and then another diagnoses you with the second. So lots of different sensitivities. No success regardless of what you try. You try a treatment and you don't get long lasting results, and then you start getting multiple diagnoses, and that's over like a time period. But those sensitivities and odd symptoms that don't make sense to you, don't dismiss it as aging. Please, if I can tell anybody out there, don't dismiss your symptoms of aging or fatigue, because your body should be able to recover, and I want you to recover. We both want you to recover. It's not normal to not recover.
And how long would you say the postpartum phase is for women? Like, how long are our bodies trying to get back to normal? Because, I feel like in society, they say postpartum is like the first, you know, 4 months or whatever. And then after that, it's kind of just brushed off as, oh, you should feel better now. Um, what if, it's 2 years later or 3 years later or 5 years later and a woman still is feeling like,
Yeah,
man, I've been off since?
yeah,
Is that
absolutely.
something
And we
that you're
see it
seeing?
for years. I mean, typically, in a perfect world, like 3 to 4 months is actually a good time. But it's a very imperfect situation that we're dealing in, and our foods are depleted. And I mean, all you mothers, my heart goes out to you. There's a ton of stress that is associated with that. And so the body doesn't ever get a chance to fully recover. And sometimes it never fully recovers. And so you can still be having um, like it's this fallout, like this health fallout after having a child for years, and so don't ignore those symptoms. If you don't feel like you're recovering fast, and those symptoms that we were talking about, as far as brain fog, poor memory, and a lot of times it's mental endurance. Like maybe you used to be able to read for 4 hours and retain what you read, and now you can read for 15 minutes and you just can't. Sometimes you find yourself, you read a page and you're like, I don't even know what I just read, right? That's a massive
Yeah.
symptom of some neuroinflammation. But changes in your personality, like shortness with your anger, your temperance, that's a big piece. But then like body symptoms are gas bloating or putting weight into certain areas that you're not used to, you're not normal to having it. Um, and then little things like vision changes, dizziness or lightheadedness. Those are all like really important symptoms that we see.
feel like I'm like, yep, yep,
Yeah.
yep, yep. Checking out. I'm like, this is why I'm going to see Dr. Dan. As you talk about, it is kind of reassuring to hear you talk about all these things, because the dizziness, the weight in different areas, the fatigue, the brain fog, the reading my Bible, and I'm like, what did they say? Like, can't even read a sentence. I'm checking all those boxes, but it is reassuring to hear you say that, because then it's not like, okay, this isn't going to be a forever thing. There are solutions, as long as you're willing to, seek those solutions, if you will, which I am. And I'm so excited to get my lab results back.
Daniel, one thing that I think is important to talk about, and we do see this, and we haven't talked about this yet, is a lot of times postpartum, and this is usually not associated, I mean, it can be a postpartum, I'm just saying, after having the child, women will experience increased anxiety or depression. And a lot of times they don't want to admit that. So like, everything in my life is supposed to be good now, and I'm feeling down. And a lot of times it's not it's not it's not you. It's not something wrong with you. It's something wrong with your biochemistry. And that is a massive, massive important understanding that something is disrupted. If you've noticed heightened anxiety or like just low level depression that just seems like you can't get away with it, you definitely want to get checked out.
Yeah, I'm so excited. And if you're here from my platform, I am going to be taking you along this journey. So I talked on stories a little bit on, seeing Dr. Dan for the first time. We're in the process right now of doing the lab results and stuff. But if you are here and wondering if it's a fit for you, I'm going to be taking you along that journey. So you'll be able to see, and I'm an open book. So the depression he's talking about, I've been experiencing, and you just kind of feel like, what on earth is wrong with me? Like everything, Dan, in our life the last year has been like, I should be far happier than I was, when I was pregnant with Luke. I mean, everything's just been incredible, like, from the outside looking in. However, I just have this lingering feeling of just like, oh, like this dissatisfied, unhappy, like just weird feeling. And I had expressed to you that it's heightened before my menstrual cycles, but I think there are a lot of women out there who are experiencing these things, but like you said, they're just like, oh, something's wrong with me. And they kind of bottle it in because they don't want to admit, like, I've got this beautiful family, I've got everything to be grateful for, everything to be happy about, but they don't feel good and they're ashamed of it, so they don't talk about it. And I think that's why it's so important that we're having this conversation, because like you were saying, like, it might not be you, it might be a health issue that once it's solved. So I'm so excited to go on this journey with you, figure out what's going on with my body, which I think a lot of women can relate to, and then hopefully come out on the other end doing a lot better.
And
is there anything else that you would like to add, that you just think women need to hear or need to know?
I would reiterate what I said in the beginning. If you're struggling to get pregnant or maintain a healthy pregnancy, or you're having some issues afterwards, it doesn't mean there's a flaw in you as a human being. It's a health issue, and it's important not to push that off. I'm always surprised at how often I hear that the women that we work with have said either they feel like they're less of a human being because they're having issues with these things, or they feel like they're a bad mother because they're experiencing this down feeling, or almost like a dissatisfaction with things, like they're not feeling the joy or the the level of happiness they think they should be, or they're struggling to get pregnant and they internalize it. And it's unfortunate because it doesn't mean something's wrong with you as a human being. It means there's something wrong with you in your biology. And I can't drive that home enough. And so definitely, get out there, find somebody that you're comfortable with, somebody that resonates with you, who's going to take the time, sit down, listen to you, and then actually dig in and identify, what it is that's disrupted in your body. Because, in order for you to show up and be the best version of you, and this even for even people who aren't trying to have a child and they're just wanting to feel great, life's tough enough. There's and there's options out there to lighten the load of what's going on the inside. So if you want to live your best life, it starts with having amazing health, and that's where you got to start, right?
Well said. Yeah, well said.
Yeah.
Thank you for sharing all of that. I have one question for you. So a lot of, the people watching here,
Okay.
they might not be in Colorado. Is working with you, if they're not, a lot of these people are in Colorado, but if they're not, is working with you an option?
Yeah, absolutely.
What does that look like?
One, you can always go to our website. It's peakvitalitydenver.com. We have, you can contact the office there. You can see what we do. But we do have a virtual team, and we have health coaches all around the United States. We call them health advisors. Yeah, so we can actually get started, find out what's going on, and then find an appropriate coach to work with you no matter where you're at, and work that process virtually. So we work with women all around the world. We have clients and patients that we're working with in Canada and the UK and Australia. So there's people everywhere, and we always tell people, if we can't help you, we'll help you find someone who can.
I love that. And so it's peakvitality.com. peakvitalitydenver.com. I will put that. This video is going to be saved, so if you didn't get a chance to watch the whole thing, definitely go back, and I will drop that link in the comments, and you can DM me, Dr. Dan, with any questions that you have. And Dan, just thank you so much for taking the time today. This has been such an amazing conversation. There's so much more I want to dive in with you about, so maybe we'll do more lives down the road. But thank you for your wisdom, and thank you for just helping so many people.
Yeah, thank you for having me.
Combo.
Thanks for everyone for being a part of this. This was wonderful.
All right, everybody, we're going to sign off. But like I said, if you have any questions, make sure to reach out to one of us. We're happy to chat about whatever we can help with. I'm happy to help you get hooked up with Dr. Dan if that's a fit. And then if this video, if something that we talked about with hormone health, women's health during trying to conceive, pregnancy, or postpartum, if any of that, miscarriage, stuff like that, is something that maybe a friend of yours is going through, go ahead and shoot them this video. It could be a huge blessing to them. So guys, thank you for being here.